What is the best way to manage fever in our pediatric patients? Are pharmacological methods more effective than non-pharmacological methods? And why? As a nurse, you might ask yourself, what are the potential benefits of fever? Well, whether or not a fever actually aids the body in fighting infection is a theory that remains unproven. But a fever can be an important indicator of illness, which may or may not require a treatment. So what are the negative aspects of fever? Perhaps the most common reason to treat a child's fever is because fever causes discomfort, and a child who is uncomfortable is less likely willing to eat, drink, or sleep, all of which are important for healing. Complications of fever most commonly include dehydration. Rarely, a high fever may lead to what is known as febrile convulsions, or seizures, which sounds scary, but generally have no significant or lasting effects on the child. In extreme situations, a fever above 42 degrees Celsius could potentially cause brain damage. While this is very uncommon, it is a significant motivator for effective fever management. How is current research of fever treatment applicable to child health nursing? Well, we're glad you asked. Nearly every child will develop a fever at some point during their childhood, whether it be related to something as harmless as teething, or perhaps an immune response to vaccinations or illness. And while serious complications of fever are rare, effective fever management is an important and common aspect of pediatric nursing. So staying current on the most effective ways to manage fever, while inflicting minimal risk to our patients, just seems like a no-brainer. So what does the research say about the need to revisit fever management in pediatric patients? Well, combination pharmacotherapy has become common practice. Yet, there seems to be insufficient and inconclusive evidence to support the efficacy and safety of this practice.
So what kind of things are happening in the care of pediatric patients that makes it important to reassess? In the present day and age, the topic of fever phobia is becoming ever more prevalent. The problems surrounding this idea can be brought on due to the pediatricians prescribing pharmacological treatments for all cases of fever, instead of treating fever on a case-to-case basis. In addition to the broad treatment of fever, pharmaceutical companies play a large role by perpetuating fever phobia within parents of young children. They put out ads that guilt parents via imagery and subliminal messaging, saying things like if they love their children, they will treat them with a certain medication.
What is the importance of using current evidence-based practice? As nurses, continuing education is a part of our profession. Research is always happening and altering practice in order to improve patient care outcomes. By keeping up to date on current research and practice guidelines, we can do our part to ensure that we provide our patients with the best care possible. Sacred cows in nursing are things that have been done for a long period of time without question. Often there is not enough research on their efficacy to back up their use in practice. One example that we will talk about in our research today is tepid sponging. How does fever management apply to nursing practice on pediatric wards? Fever is common on pediatric wards as it is part of the body's innate immune system response to infection or inflammation. It is important that nurses are aware of the best practice guidelines and the current research surrounding the efficacy of different treatment methods. This is to ensure that we are the best possible advocates for our young patients and their families in what can be a scary situation.
According to research, what are the recommended pharmacological treatments? Two separate studies by Kramer and Paul researched the efficacy of alternating the administration of ibuprofen and acetaminophen versus independent administration of an antipyretic drug. The studies found no clinical significance to support the combination therapy due to safety regarding overdosing, underdosing, and the timing of administration. Therefore, monotherapy of an antipyretic drug is recommended.
Jayawardena and Kelstein's article compared the use of acetaminophen suspension to ibuprofen suspension in order to determine which had a greater efficacy. They discovered that ibuprofen had a quicker onset of fever reduction, longer-lasting temperature reduction, and fewer incidences of treatment failure. Therefore, in terms of monotherapy, the recommendation is ibuprofen over acetaminophen. The article by Thomas compared the use of tepid sponging alongside an antipyretic medication versus antipyretic monotherapy. The study found faster temperature reduction in the initial 15 to 30 minutes with tepid sponging. However, after 2 hours, the temperature reduction in both groups was the same. In conclusion, antipyretic medication alone is recommended because although there was a faster initial drop with tepid sponging, the participants' discomfort was higher and statistically significant, which the researchers believe outweighed the benefits of the initial drop.
Aluka's article compared the use of tepid sponging to acetaminophen, where the researchers found results similar to Thomas. In conclusion, the use of tepid sponging is discouraged and antipyretic medication, more specifically acetaminophen, is recommended in the treatment of fever in children. The overall recommended treatment is antipyretic monotherapy, more specifically ibuprofen over acetaminophen. Since there is a general lack of research with conclusive evidence, more studies need to be conducted to determine what is the most effective treatment.
However, as nurses, we also need to take into consideration all the other factors contributing to treating fevers in children. These include whether a child has underlying conditions such as impaired liver function, respiratory infections, gastrointestinal issues, or if they are a premature infant. When treating fevers in children, it should be done case by case because the treatment for febrile children can vary depending on what underlying factors or pre-existing conditions are influencing the child's health.
What we learned about today. We discussed the positives and negatives of fever and complications associated with fever like dehydration, how pharmaceutical companies perpetuate fever phobia, the importance of reassessing fever treatment methods to ensure efficacy and put a halt to sacred cows in practice. We looked at what the current research had to say and the recommendations for fever management, as well as things that you should consider in your everyday nursing practice.